Hi, I am Dr. Elo, one of the elite ICE 50 avatars to present this course on Complete Guide to the Dental Peer Review Process by Gina Gallagher, October 20th, 2023. As a dentist, you have hundreds of positive interactions with your patients every year. But sometimes, disputes arise about the services or treatments you provide, and a handful of these can't be resolved without help. This is where a dental peer review committee might come in. The American Dental Association estimates it sees about 3,000 annual dental peer review cases nationwide. The goal of a peer review is to provide a fair, quick, and confidential resolution to disputes, usually through mediation services, though sometimes involving a dental peer review board. Peer reviews differ from other formal approaches to handling disputes, such as malpractice suits or licensing board reviews. This useful guide explains the dental peer review process, answers questions about how peer reviews differ from malpractice claims and licensing board reviews, shares available resources, and guides you on how to prepare for a dental peer review if you are ever involved in one. It ends by explaining how dental malpractice insurance can help protect and support you if needed. Let's get started. What is peer review in dentistry? The dental peer review is a confidential way to resolve disputes about dental care and treatment. State and local dental societies manage peer reviews, but each society's guidelines and processes vary. Most dental peer review programs consist of about 5 general dentists who volunteer to serve as impartial board members. In some cases, dental specialists and even non-dental professionals, in some cases, it's members of the community, are asked to assist. Dental peer reviews may handle these 3 primary types of complaints made against dentists. 1. Quality of care. A peer review will look closely at the treatment provided by the dentist to ensure that it meets the standards of high-quality care. Consider it a form of quality assurance. For example, they may review whether a particular procedure was done correctly. 2. Appropriateness of care. Peer review boards may also review if the treatments and evaluations were necessary and in line with the concerns and diagnosis of the patient. In doing so, they may review the patient's oral health, existing medical conditions, and complexity of the case. 3. Fairness of fees. The fairness of fees, which could involve concerns about the amount charged or what the fee covered, may also be evaluated by some peer review boards, though not all. Whether a dental peer review board will review complaints about fees depends on the constituent or local dental society. A few other things to know about peer reviews according to the ADA. Most boards allow for disputes between dentists and third parties, such as payers, dental service corporations, health and welfare plan administrators, and employers. Peer reviews do not address disputes you have with another dentist, cases already in litigation, allegations of fraud, or violations of the State Dental Practice Act. The American Dental Association, ADA, provides broad recommendations for peer reviews but does not impose national requirements, act as an appeal body, or generally intervene in cases. Legal release. The views expressed in this article do not necessarily reflect those of ICE 50. One must consult with their legal and financial representatives for any and all legal advice.